figured into that, as well as you know, smoke detectors and sprinkler systems.
Could you just go over the flexible dining program once again, please?
Sure. It's kind of like, I've heard one of the other girls kind of explain it, kind of like if any of you have got children or grandchildren going to college and they've kind of got a dorm policy that's going on to where you're just given each person. So if it's a couple, you know, Mrs. is going to get $300 credit and Mr. is going to get a $300 credit. And you use that throughout the community in any of the venues that you want.
Per month?
Per month, yes,
yeah.
per month.
Per monthly fee.
No, I understand. So you think the dinner, breakfast and all those is for $10 every day?
Basically what they've told us is around, it's going to cover maybe 20 to 24 meals a month, depending on how you spend your money.
Day,
yes, because remember, you're coming into independent living.
No,
So, yeah. And every apartment, you're going to have your own kitchens and all that, the ability to you know, cook and all of that. So, but you have the ability to use those credits however you want. So just as an example, the dining room is probably going to be a little more expensive than going to the Cafe Bistro Pub, because there you're going to get soups, sandwiches, salads, that type thing. So it's all on how you decide you want to use your credits.
Do you have to use it up every month? Or?
You have to use it up every month. It does not roll over. Mm-hmm.
And those who live in assisted level or you know, that sort of level, they also get $300 or
No, once you transition into the healthcare side, it's different. The meals are included in their life care. So they're not given credits. So their meals are
the monthly
included.
fee, which is higher, takes care of things.
Yes.
So somebody cooks for you, right? And then,
Yes. Yes.
But where you get that credit?
So right now, because we're still under construction, we have special construction
Where you get
benefits.
that credit? So you pay
you can
Actually, some of our residents have had the ability to come in and pick out their finishes for their apartment, but because where we're at right now, we're down to where there's only like 4 apartments left to where you could come in and actually pick out your paint and the different colors that you wanted. However, we do have an interior decorator on staff that has decorated the unsold apartments that have already been personalized, and she's done an excellent job. So, you know, if you come in and you decide that you like a particular apartment in a particular area, we can have her show us exactly what finishes have been chosen so that you'll know what's being included. Also, if you would sign up now, you'll get a waived monthly service fee for 1 month. This is the huge thing. You're guaranteed occupancy and the life care guarantee. Once you place your 7% deposit, you're guaranteed occupancy and life care guarantee. The other thing that I want to mention is now is the easiest time to get into a life care community because of where we're at. We are not asking anyone for physician papers, you know, a physical or anything be done on any of our depositors. It's total disclosure by the residents. Once we open, it won't be as easy to get the life care guarantee. Once our doors open, we will then have to start doing the physicals per se to eliminate those that maybe have Alzheimer's. And we've not been given the criteria yet that we'll be working with, but technically in a life care community, the diagnoses that they usually look at is Alzheimer's or a memory care issue. It might be Parkinson's, and it might be whether or not you're a diabetic. So
You'll be refusing those cases?
we would be refusing life care. We would not refuse someone to live with us with those diagnoses, but we would not be able to honor them with the life care guarantee if they had those diagnoses. That's why I say right now is the easiest time for someone. So if you know someone that is, you know, looking for retirement living and has one of those diagnoses, now's the time to get them in here.
Yeah, but I don't remember the numbers, your first few slides. The life care numbers,
You mean to say-
apartments were so few against individual living and skilled care numbers. How would you accommodate all the people for life care?
Well, part of that is why when we open the doors, we will have to start doing the physicals to make
I
sure
know,
that
but
we
I'm
get.
talking now. You said you got only 4 apartments left.
Oh, we have 4 apartments left that we can personalize. We have more than 4 apartments left. Out of the 134 apartments, we're over 75% sold. Okay, so we have more than 4 apartments available, but we only have 4 that if someone really wanted to come in and pick out their paint and their finishes, that I could promise that I could get that for you. Does that answer your question?
Somewhat. I need to see that slide again. That was your 5th or 6th slide in terms of numbers. See,
Oh,
once,
okay.
Once you're talking about guaranteeing the life care, and your numbers of people are more that you are entering right now.
Well, and I think I know where you're going with this. When we first open, what we will be doing is we will be bringing in people from the outside that will be paying street rate for their care. So, because the people that are moving in now are putting their deposits down, are planning on going into independent living. So in order to be profitable and make our health care work, we're going to be taking referrals from the hospitals. You know, of course, we'll have rehab there as well. So, you know, we know that for the first few years, we're going to be counting on the outside until we get our population to where our people are then moving forward. Does that make sense?
Yeah, you're talking finances. I'm talking physical.
I think I know what he's talking about.
Okay.
The reason I have a better mental picture is I saw they have a 3D model. I wish he had brought a picture of a 3D model. The way they have distributed is about 75–80% of their capacity is independent living,
Right,
and
right.
20% is the assisted living.
That is
That's
exactly
what he
what I'm
was
talking
asking.
Yeah,
about.
that's what
Okay.
you're
If the
It's not
80%
for-
are independent living,
Mhm.
those independent living someday will require.
Sure.
Exactly.
I think the formula in the background they're working is if there are 100 people in independent living, 5–10% every year are going to transition.
Get on it.
Yeah.
Right.
That's the formula.
I'm sure they have worked out the finances, so.
Yeah, yeah.
I'm not
Because the
talking, I'm not
initial-
worried
You-
about.
you-
You're
get,
wanting to make sure
But there
that
would
those
be
people
space
that we
there.
brought in are
Yeah.
going to have health care.
Yeah.
That is what I'm
Okay.
talking
I think
about.
the ratio is
Because,
1:4. I think.
see, I think those formulas are totally wrong because they are based upon life expectancy of 80. That is now 90 to 100.
Exactly.
So they're not going to die in 2.5, 3 years. Those are old data.
Actually, because I've worked in other communities as well, on a weekly basis, what the staff does is they meet with the executive director, the sales director like myself. They meet with all of the directors of healthcare, also our dining services staff and all of that. We keep a very close eye on our residents, and we have what we call collaborative care meetings. And what we will do is we talk about, well, I noticed Mrs. Smith in independent living, this wasn't herself today. So we plan ahead to know that, okay, somebody needs to check on Mrs. Smith and see what's going on. Is maybe she going to need to transition into assisted living or skilled nursing or down the road? So they do keep a very close tab on all of that to make sure that we're planning ahead so that we have the availability for them. But to take it one step further, because I've had people say, okay, well, I don't believe you. What if you are full and I need health care and you don't have an open spot for me? What are you going to do then? We will bring the care to you in your independent living apartment until we have an opening. Does that help?
Yeah.
But
I just want to clarify one point. So someone who's living independently, after 2 or 3 years, may develop diabetes. You will obviously offer life care.
Exactly.
You will not refuse.
Exactly.
Okay.
No, as long as, that's why I said right now, if you get in, you're guaranteed that. So that even if you have a health care change between now and the time that we open up, you know that you still have that life care guarantee. So in essence, what a lot of people are doing this for is kind of like a long-term care policy. So, because they know, bottom line, if they change their mind, they can cancel at any time.
Is the monthly fee going to remain same throughout the life, or it will change?
It will change. Those numbers are guaranteed until the middle of 2015. Then at that point, it will be subject to the cost of living increase, just like it would be at any other community.
So how much will be? It depends.
The most, as a whole in our organization, they say it's been like 2 to 3%.
Every year?
So, one of my questions is that the $23.95 and the $32.95 figures, one's the life care and one's independent. If you get the independent now instead of the life care, and later on you can get the life care.
You could come in now and come in as independent and not try for the life care.
Right.
And then say a couple of years from now you decide, okay, I would like to do that. You would have to go through the physical to qualify.
Okay, but I thought that you just said that if you do that, then you're guaranteed life.
Right now, that's true. Right now, with where we're at, anyone that comes in and deposits is guaranteed the life care guarantee.
Deposits the $23.95 or $32.95?
Well, you're going to come in, because if you're living independent, you're going to be paying whatever the monthly service fee is for independent living, the $23.95.
Right.
But let's say you come in, you sign up for independent living, and you have a change of health between now and the time we open up, and instead of independent living, you're now going to need assisted living, then you will pay the $32.95 because you're going into.
But if you don't qualify because of the physical that you require,
but right now we're not doing those physicals. Right now we're not doing that. That's why I say this is the best time to do it, because you could come to me, and I have had people, in fact the people that I closed on today, I know that the wife has Alzheimer's. We closed on them today. They have the life care guarantee. So as she progresses, they have that peace of mind of knowing that when she needs to transition to memory care, that they're paying the $32.95 versus paying street rate of $6,000 to $9,000 or $10,000 a month.
Okay, so let me just make it clear so that everybody understands.
Okay.
So once you have opened up this center and it's running, then someone comes in, a couple or single person comes in as a independent resident. You would do their medical at that time?
It's called pre-certification.
Yeah, pre-certification at that time, yeah.
But once they get in, and after a couple of years, someone develops diabetes, then they will be automatically guaranteed the life care.
Exactly. Once they are approved into the life care, you can't take that away from them. So, That's what's so great about it.
So can I explain something?
I think once you're there, then change is
Acceptable.
guaranteed.
Right.
And to get into the system, once they have opened up the center, you have to be
Pre-certified.
I think, can I add something? Some of you who are not familiar with long-term care insurance policies and healthcare and medical side, and some of you are not familiar with, you're not in the healthcare, some of you are still younger, and that's why you haven't figured that out. Even when you go to buy a long-term care insurance policy, just like in the olden days, healthcare insurance policy used to be for before Obamacare, you have to get pre-certified. Like I have a long-term care insurance policy through the federal government. So there's a whole list of questionnaire that you have to answer. And you know, in our case, we can lie on that, but you know, suddenly, if you get the policy today and tomorrow you say you got Alzheimer's, they're not going to cover you. So you have to be honest. But if, let's say, when I got the policy, I was around 47, a couple of years back. But let's say if I had gotten the policy at 65 or something, then they would have sent me to a doctor's office and gotten a pre-certification physical and all. So that's pretty standard what the commercial world already does. So what they're doing is not anything unusual. It just, I think most of the people in the audience aren't familiar with that.
But the new health law, the Affordable Act,
That doesn't apply to long-term care. That
doesn't
Yeah.
apply to you that you can.
It does not apply
Only
to
if
us,
I-
yeah.
No, it doesn't.
So a related question.
Sure, go ahead.
Once you reserve it, you have to move it, right? You cannot postpone it.
No, you don't
It's
have
up
to
to
do,
you.
you
You
just pay the
No,
fees.
continue paying
It's up
anyway.
to you.
Yeah, it's
You
up
can
to
pay
you.
the- You can buy it, pay
No,
the
no,
monthly
but
fees.
suppose,
the
you know,
monthly
you
payment
paid,
once you
said,
reserve
okay,
it.
I might need after
You
5
don't-
years.
you don't-
What do you pay?
But you're paying every month.
You have to pay monthly fee whether you move in or not.
Ah.
Not only that, but you have paid
No,
250,000 or
okay.
whatever.
Okay.
Actually,
let's
if you
back-
just pay initiation or something and not pay, is that future
No.
reservation?
No.
No.
Basically, I just want to make sure that everybody's clear on this too. If you put the 7% deposit down now, you don't have to start paying a monthly fee until you move in.
No, but until you open, right? Is that what you-
Exactly.
Yeah,
Until you
so-
open.
But once you
That's
open,
all.
you have to move it, right?
Right.
No, you can, remember I said, once we notify you and say that we're ready for you to move in, you can come to me and say, I don't want to do this, Dana. I want my money back.
Oh.
And it's guaranteed in the contract that I give you your 7% deposit plus interest back.
But that was not a
I think that
question.
the question is a little different.
Yeah.
Oh,
I think
okay.
I think the question was, he says that if he pays something, whatever it is,
Uh-huh.
right? And he says it's not that he wants to move at the time when you open, but let us say he wants to move 3 years down the line.
Mhm.
Right?
Can we do that?
Can we do that? And then
You pay it.
he doesn't have to pay the monthly fee, of course.
Well, let me address that. We know we're going to have 134 independent living people trying to move in. We know we can't have them all moving in at the same time, so there's going to be phased move-ins. So they have told us that our first phase is going to be the November, December-ish area. And then second phase will be December, January. Long story short, it's going to phase into like March or April of 2014. So yes, in essence, you can put that off. There will be different things in place for you to put that move-in date off, but you're going to come to a point where I'm going to say probably within a year, but I don't know that for sure, but I'm going to say probably a year or so, they're going to say, okay, we need you to move in or not, because they're counting on you to do that.
Sanjay, you had a question there.
So this was a question related to the long-term care.
Mhm.
So let's say if somebody has long-term care, right? So does that make sense for that person to go into assisted living? So
Sure. Let me explain what a long-term care insurance policy
Vipin bhai,
covers.
we have 5 minutes to wrap it up.
Okay.
Then if an individual has any question, then they
Okay.
can ask.
Sure, I
But
will
I
give
think
you
this is a
brochure
very good
that-
discussion. I don't want to,
Sure, sure.
but our time is.
I understand. I appreciate
Sure.
it.
The long-term care insurance policy basically covers either sending a visiting nurse to your home or assisted living or a nursing home. That doesn't cover any of these monthly fees, etc. This is like living in a resort. They don't pay for that.
Yep.
They will.
Uh,
It will cover.
not independent units. Not independent.
Not independent, but it
Long-term
will
care.
in healthcare.
It doesn't-
It will in healthcare.
So as long as you have independent capacity for independent living, it will not pay.
Yeah, it will not
Right.
pay.
But anything after that, it does pay.
We'll let her
Exactly.
wrap it up, and then she'll give brochures and her number, telephone number, etc. Then you can call her for more questions. So you
Okay.
take 5 minutes.
The other thing is, what we're offering now is a free underground parking space for life. They're telling me that once we open up, we're gonna start charging a one-time fee of $15,000 for that underground parking spot. So, and all in all, this is about $60,000 worth of savings. So, that pretty much wraps everything up. I do have brochures here for anybody that's interested. I would recommend that if you'd like to learn more about the Barrington, it really is a good idea to come into the information center and see the different floor plans, because we've got so many different ones to offer. And, you know, we can talk one-on-one about your individual situation.
Very good. Thank you very much.
Thank you so much.
I'll get one question.
Okay.
Which will interest everybody. Do you have in your construction plan at present moment an area where our group, if they're interested, they can occupy that area on one floor or one building or something?
Actually, if just one specific area of apartments, correct?
Yes.
Is that what you're? Actually, right now, we don't, because it's the way that we have sold the apartments on all 3 floors, it's pretty evenly spread. So, you know, that's not saying that we still have some where there might be 2 together here and there, where we could do something like that, but.
However, they have a vacant wing which they haven't built yet. There is a whole wing which can be built in a year.
Exactly. It is actually considered our phase 2 of building, which we just talked about this morning. I think they told me there was going to be like 32 additional apartments, but that won't be for another couple of years.
Yeah, thank you very much.
Thank you very much for your time.
Thank you very much.
And she'll pass some brochures.